patient is an 85-year-old Asian female who presents to the clinic with a complaint of gradually increasing weakness of her legs as well as some loss of balance. She also has dyspnea on exertion that subsides after several minutes of rest, and she also complains of cough, a pushing sensation on her chest, and some breathlessness when she's sleeping at night, but she does not feel the need to prop herself up with pillows while sleeping, and this symptom is not of great concern to her. Additionally, she's had 2 visits to the hospital, the first one being in May of 2011 when she had severe dyspnea. She was admitted to the hospital for 1 week. A month later, she was readmitted to the hospital for the same symptoms. After the first visit to the hospital, she had marked edema of her lower extremities that resolved quickly and has not recurred. During these visits, she was diagnosed with diastolic dysfunction. On her past medical and surgical history, the patient says she has had no major illnesses, but describes herself as being a weak and sickly child. The patient is currently taking multiple medications to include warfarin, 10 milligrams daily of lisinopril, 25 milligrams daily of metoprolol, 70 milligrams daily of alendronate, sodium fluoride applied to the teeth, docusate sodium, polyvinyl alcohol, 40 milligrams daily of furosemide, 3% daily hypromellose, calcium supplement, and a multivitamin daily. She has no known allergies. The patient was in a bad car accident that caused some shoulder trauma, and it was left unrepaired until she fell down the stairs and re-injured her shoulder, whereupon she got surgery and has had no problems with her shoulder since. She has also had carpal tunnel release on her right wrist and has had bunion surgery. She cannot remember the dates of any of these surgeries. On her social history, she has a 1-year past history of smoking, but she quit approximately 45 years ago. She has minimal alcohol consumption because she dislikes the effects and she has no illicit drug use. She gains much support from her son, whom she lives with, and she has 1 daughter who lives on the West Coast. Her heart condition has given her a new mindset that has made her more mindful of her body and has caused her to slow down when she needs to take care of herself. She has also changed her diet, eating more fruits, vegetables, and fish, and eating only fresh foods, as well as cutting down on her salt intake. However, she does still enjoy using soy sauce in her foods. She has also increased the amount that she's exercising, including walking on a treadmill and biking regularly. For her family history, her father died of a stroke and was a heavy smoker. Her brother had a stroke at age 70 and has had high blood pressure for many years. Her son also has high blood pressure. On physical exam, the patient is a friendly 85-year-old Asian female who appears to be in no acute distress. An irregular rhythm is heard upon auscultation of her heart that is consistent with the atrial fibrillation that she is known to suffer from. Palpation of her radial pulse also showed an irregular rhythm. All other vital signs were normal, and she had no jugular venous distension and no edema of her lower extremities. No labs or imaging were provided for this patient. On assessment, the patient suffers from diastolic dysfunction that is causing her dyspnea on exertion, the coughing, the probable paroxysmal nocturnal dyspnea, and the pushing sensation on her chest. It has also caused atrial fibrillation. Most of her symptoms are well managed, but her increasing leg weakness and loss of balance indicate that her heart failure is either getting worse or is not managed well enough. For plan, I would continue to counsel the patient on the importance of healthy eating, especially on cutting down on her soy sauce intake, and exercise, and ensure that she is weighing herself daily for any noticeable weight changes. Because she is suffering from leg weakness and loss of balance, she might need medication adjustments depending on whether her blood pressure and heart rate are well managed, or she may need a vasodilator to help increase the blood flow to her lower extremities.